The number of people in England estimated to have COVID-19 has dropped 40% in just a week. Look at the number of cases over the past year. After spiking over the winter, cases now mirror those seen before the pandemic and summer of last year. A SAGE report found the vaccine might fail to prevent hospital admissions among a very small number of people, particularly the elderly. Between December the 8th, when the UK began its mass vaccination rollout, and April the 10th, there were over 50,000 hospital admissions. 3,500 of those had received the first dose of a COVID-19 vaccine. For most of these patients, the time between vaccination and hospital admission was up to 15 days, where infection occurred before immunity had developed. The researchers say there is a possibility that vaccinated elderly and vulnerable people may have been exposed to coronavirus after wrongly assuming they were immune. 526 people with a positive COVID-19 test were admitted to hospital more than 3 weeks after receiving their first dose. 113 died. These cases represent vaccine failure, which occurs when a person contracts a disease in spite of being vaccinated against it. But experts say, despite this, there is still a lot of cause for optimism.
This is really good news. It's real-world data. But the cautionary tale is it does take about 3 weeks to get really good immunity from the first vaccine jab, particularly for the older population. So people do need to be careful for just a little time after they've had that first vaccination and make sure they get the second jab later.
All the data is positive and it's very encouraging. The vaccine rollout is having a real impact on the virus. There are always caveats in a pandemic, but we can certainly look forward to the summer with increasing confidence.